everyone, I am Dr. Kishan Rao. In this video, let's discuss about how to ace the Viva woes in MBBS exams or any exam for that matter. First, we should understand the purpose of Viva. Any examiners would test your conceptual understanding, not just what you have memorized. For example, knowing virtuous node or Trojer's sign is fact or knowledge, but how only left supraclavicular lymph node enlarges is the concept behind it. So, that's what checked in the exam, so we should be prepared for that. Next, application of knowledge like your clinical reasoning skills, how to come to a conclusion or diagnosis is what important. Especially in your practical examination, you have a set of questions or pro forma for history taking and examination, right? In that there are so many things in general, but when it comes to a particular case, how do you really apply them is what important. For example, there is fluctuation test, trans-elimination test for swelling examination, but you should apply only in case of cystic swellings. That is the application behind it. Third and most important is the communication skills, in which any examiner would check for your clarity in answers and how confident you are while answering, and not just the content alone. So, my suggestion would be approach Viva as a discussion, not as an interrogation. Before the Viva, know what are the common types of questions asked. Any examiners usually ask common basic definitions and classifications like what is shock, what is ulcer, what is edema, and name the classification of hernia, etc. Some pathophysiology or mechanisms behind, like how smoking causes lung cancer or COPD, or what is the mechanism of RAS in hypertension, etc. Some basic investigations and its interpretation may be asked, like ECG changes in MI. Some of the clinical applications like what is the first line treatment for pneumonia, what is the treatment of choice for varicose veins, etc. While answering, please be crisp, clear and concise. You should structure your answer in such a way that it should be very brief and complete. Don't try to beat around the bush. Don't try to over explain to the examiner. If you are unsure about the answer, start with what you already know and then logically build from there. Use keywords, not very long winded explanations. For example, when the types of shock asked, some students who are not sure about the answer, they start mumbling. Shock is decrease in BP. There are so many types, maybe like this. So, this is not the way. If you are very sure, try to tell the exact definition of shock and then tell the classification of it exactly. Don't try to beat around the bush there. If you don't know the answer, it's not a crime to not to know some things, but how do you tackle such tough situations is what important. During that time, stay calm and composed. Don't panic. Examiners observe your response under the pressure. Do you yield to the pressure or you face the challenge? Be honest. Say, sir, I am not sure, but I think it could be this. Some logically try to answer that, but never say I don't know immediately, because that's just giving up just like that is not appreciated. You should also practice rapid fire questions beforehand. Some of the common questions asked in Viva was like definitions, what is anemia, what is cyanosis, what is jaundice, all those definitions you should know beforehand, not after going there and thinking in the exam hall. Some of the normal values they may ask, what is the normal potassium levels, what is the normal PaO2 level, what is some clinical signs, what is Gray Turner sign, what is Cullen sign, all those things. Some drug of choices, treatment of choices, all those are very common and simple questions to answer straightforward. So, I would like to advise you to revise these high yield facts before the Viva and better to practice with friends. Most importantly, improve your communication skills and the body language. The first impression is what matters for the examiner, right? How do you come to the exam hall? How do you sit after taking the permission? How do you respect your examiners? Maintain the eye contact with the examiner. Speak clearly, loud enough and confidently. Don't just mumble. Sit upright and attentive to the questions. Body language shows your confidence levels also, and avoid fillers like you know the what. So, don't be straight, forward to the answer. So, for this it is very difficult to do straight away in the examination. So, please practice with the seniors or some known teachers or your friends beforehand. Be ready for clinical and image based questions. You know what are the spotters kept in the exam beforehand, what are the common auscultations, you know. X-rays, ECGs, some pathology specimens, some instruments will be invariably kept in the exam. And for undergraduate level, we keep those common ones only, like in X-ray, in surgery, there is one invariably kept X-ray, that is gas under the diaphragm. In the medicine, they may keep pneumothorax, TB or cardiomegaly. So, these things you should be well versed beforehand. Some ECG common ones, pathology specimens and instruments, the common instruments you should be prepared with. My advice would be, when such spotters are asked, do not try to directly jump into a conclusion or inference, instead interpret it completely. If an X-ray is given, try to interpret each and everything. There are so many techniques, ABCD technique, inside out, outside in technique, for which separate videos are there available in our YouTube channel, Vitamin YouTube channel, you can check it out. So, do not direct straight away tell it is gas under the diaphragm, no, you have to interpret the entire radiograph and then come to a conclusion that this is this, okay. That is what checked in our examination. So, finally, revise smartly and stay confident before the examination. Last minute some Viva revision tips would be, focus on common questions and high yield core concepts. Group discussions definitely reinforce your learning. Explain topics out aloud, explaining to others or teaching your peers would definitely help in retention of the concepts. Stay calm and positive before the examination, because as you know, confidence is the key. Hard work plus self confidence equal to sure success, okay. So, my take home message would be, more you sweat in the practice, less you bleed in the battle. Hope you understand it. So, work hard, work smart, wish you all the success. Thank you.